Hello, welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Glad that you could join us today. Our guest is Janet Hieshetter, Executive Director of the Dystonia Medical Research Foundation. She's here to talk with us about Allergan's BOTOX as an effective treatment for cervical dystonia. Welcome to the program, Janet.
Thank you very much.
Thank you. We've talked before in other segments about your research as Executive Director of the Dystonia Medical Research Foundation, and also your collaboration with a company known as Allergan Incorporated. For quite a while now, BOTOX has been used as an effective treatment for dystonia, specifically for cervical dystonia. Could you talk to our listeners briefly about what cervical dystonia is?
Sure. So cervical dystonia is a focal form of dystonia, which is a neurological movement disorder. And in cervical dystonia, the result is that the positioning of the head has been changed. The muscles in the neck are pulling the head down toward the shoulder, or maybe forward toward the chest, or in some rare cases, back. And we don't really know why, and we don't know the mechanism yet in any form of dystonia, actually, at this point.
So there's a lot of opportunity for misdiagnosis, yeah?
There is. We don't have biomarkers that physicians would typically use in making a diagnosis, so it's not unusual for people to have to go from doctor to doctor to get a diagnosis accurately made. And generally we recommend people seek out a movement disorder neurologist, which is sort of a subspecialty in neurologists, because those are the people who commonly recognize and treat cervical dystonia. So you know that you're getting an expert sort of workup and treatment plan when you're working with a movement disorder neurologist.
Your foundation, the Dystonia Medical Research Foundation, how long has the foundation been in existence?
So we are this year actually acknowledging 40 years of service to the community. It's not an anniversary that we celebrate. We would much rather there be no need for the organization to be here. But we were founded 40 years ago and have been working to support research that will lead to a cure and are being able to close our doors. But because we recognize that the science moves way too slowly for those who are waiting for answers, the DMRF is also committed to awareness and education, advocacy, and support for those waiting for those scientific answers.
Are the symptoms of cervical dystonia something that a person can immediately say, hey, something is wrong, or does it persist over a period of time and then, say, a week, 6 months, maybe years down the line, all of a sudden you have dystonia, no question?
Well, it presents a little differently in different people. So for some people, they might wake up and feel like they've just slept funny, and their neck is painful and they don't have the mobility that they normally would have, but they just sort of dismiss it. We've all sort of slept in odd positions and have awakened, with a crick in our neck, and then it gets progressively worse. For other people, it does present, in a more severe sort of form where their head is being pulled down toward their shoulder, and it stays there and it's in a fixed position. So it's a little bit, difficult to say that that it presents in one way for all people. Which makes, I think, diagnosing it from a physician standpoint difficult. If you've not seen a lot of dystonia and somebody comes in, with sort of the crick in their neck, they say, well, maybe you should see, a massage therapist. Maybe you just slept wrong.
Yeah. So you talked about your foundation being actively involved in finding a cure. Obviously, no cure yet. But what about the treatment once you've been diagnosed properly? What about the treatment for dystonia?
There are a number of effective treatments, and I would say that about 20 years ago, the whole landscape for treatment really was changed dramatically with the introduction and approval of BOTOX for the use in cervical dystonia patients. Up until that point, the treatments were, oral medications, sedations, that kind of thing, leaving people foggy-headed and really not having any sort of quality of life. So when BOTOX was introduced, people were able to to actually have a life back in many cases. So BOTOX is effective for generally 12 to 14 weeks. It has to be injected into the muscles that are doing the work of pulling down your head in the case of cervical dystonia. So, patients see their movement disordered neurologist 4 times a year or so. BOTOX is injected. It helps to weaken that muscle by sort of interrupting the signal from the nerve. And in many cases, the pain is relieved, and the person has relief from that muscle being pulled.
When many people hear of BOTOX, the first thing we think of is cosmetics, cosmetic surgery, and whatnot. Is this something that can be administered in a plastic surgeon's office, or do you have to be a neurologist in order to use BOTOX for the treatment of cervical dystonia?
Well, dystonia BOTOX has certainly been utilized for cosmetic purposes, and but when you're using it therapeutically, you want to be working with a physician who is an experienced injector because, needles are used. Not everybody loves getting shots, right? So there's that issue. But you want to make sure that you're working with somebody who knows what muscles should be injected and how to do that to maximize the benefit that you're going to get from the treatment. So we, again, recommend that patients work with movement disorder neurologists if they have access to those physicians, or an experienced neurologist who's done these kinds of injections. So some physicians will just palpate the muscle. They'll just feel it out, and then they know where that sweet spot is, and they inject at that site, keeping good records of where they've injected, so that when you come back in the next time and you have a conversation with your doctor about, how were you these last 3 months, they know that was the good spot to inject. Others use EMG. They use a guided sort of injection, so they inject the needle to sort of hear the activity of the muscle. And they are sort of being guided by that noise that says this muscle is very active. It's the one that's really pulling, and they inject there. So, different physicians use different techniques. We encourage patients to make sure that they're working with a physician they feel comfortable with, they can talk with, because, things change over time. We know stress can really exacerbate the symptoms. And you want to be able to talk to your physician about whether or not this is working for you. What's going on in your life. You might want to up the dose or lower the doses, those kinds of things. So you have a good communication with your physician.
About how many people are affected by cervical dystonia?
That's a great question. So we estimate that there are 300,000 people in North America who are affected by all of the dystonias, and that of that, maybe 50 to 75,000 are affected by cervical dystonia. But the truth is, we really don't know, and we need to do more work in identifying exactly how many people are affected. We think that there are a number of people out there who have either been not yet diagnosed, and our hope is through programs like this and other awareness efforts, we can really reach those people so they can get treatment.
Do you find that maybe cost is a reason that we're not seeing more people seeking treatment for it? Is it something that's cost effective, or is dystonia something that you can live with if you've got the gumption?
Well, I think dystonia, especially cervical dystonia, can be incredibly painful and disabling. And there are, as we've talked about, botulinum toxin treatments, BOTOX treatments are effective for cervical dystonia. It is, medical treatment in this country can be very costly. There are programs in place to help those who may need financial assistance. I know Allergan has a patient assistance program to assist with this. The National Organization of Rare Diseases has a assistance program for patients with cervical dystonia who may need financial assistance. In the case of blepharospasm, that is covered by Medicare. Most carriers in this country do cover botulinum toxin injections for cervical dystonia. It is approved by the Food and Drug Administration, so it is on-label use. But if people are having trouble getting their treatment covered, I encourage them to contact the foundation. We work with patients to make sure that they are able to access this treatment because we know for many it works, and we want to do what we can to make sure they have access to it. And people can contact the DMRF on our website, www.dystonia-foundation.org, or by contacting our toll-free phone number 1-800-377-3978.
Thanks for joining us, Janet. It's been a pleasure.
Thank you so much. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, talking with Janet Hieshetter, the Executive Director of the Dystonia Medical Research Foundation. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.